Hi Josh, how are you today?
Good, thanks.
My name is Megan. I am a basic foot care nurse. So I'm here today to provide a foot assessment as well as provide you some foot care.
Okay,
So the first thing I'm going to ask is for you to provide me consent to begin.
I consent.
Great. Can you tell me if you have any allergies or drug allergies?
No,
Perfect. Do you have any medical diagnosis?
no,
Do you have any past medical diagnosis or any past surgeries?
no,
Do you take any medication?
no,
Perfect. Do you have any foot concerns?
no,
Do you have any pain or arthritis to the feet?
no,
Any numbness, tingling, or any poor sensation to the feet? No. Do you have any concerns with range of motion or any structure of the feet?
no,
Perfect. What do you use to walk? Do you use a cane or a walker?
no devices.
Do you wear socks and shoes when you go out and in the house?
Socks and running shoes for the most part.
Perfect. Okay. Now, the first thing that I'm going to do is assess the color of your feet. So they appear to be your natural tone, which is perfect. And then the next thing I'm going to do is use the back of my hands to feel the warmth and temperature of your feet. And so they are warm to touch. So again, you said there was no numbness, tingling, or sensation concerns. I do note a little bit of dryness to the plantar aspect of your feet. So we can apply some moisturizer at the end. So that would be great. I don't see any callousing on any warts, fissures, corns, or any blisters or anything like that. I'm going to look in between your toes as well, just to make sure. Perfect. I'm also going to look at your nail beds, which are nice and smooth and pink in color. The nails can be trimmed. I'm also going to do a capillary refill test. So I'm just going to pinch your toe and the color should return within 1 to 2 seconds. And then the next step that I'm going to do is assess your pedal pulses. Perfect. So that's your dorsalis pedis pulse as well as your posterior tibial pulse. So nice and strong and regular. Okay. Any other concerns or issues?
Nope.
Let's begin. Okay, Josh, so now we're going to begin trimming your nails. So the first thing that I'm going to do is perform hand hygiene. And then gown on some PPE, such as like an apron, mask, as well as some gloves that I have here. And the first thing that I'm going to do is open up my tools. Okay, and then I am going to clean your toes with an alcohol swab. And if at any point you have any concerns, please feel free to stop me and you can ask questions or anything like that, okay?
Thanks.
Okay, so the first thing I'm gonna do is use my blacks files to just clean around the edges of the nail as well as just underneath. So I'm just gonna go like this. How does that feel? Any concerns there?
Feels great.
Okay.
Very easy.
And here I'm just looking for this the sulcus and the hyponychium, which is that excess skin growth. Okay, the next thing I'm going to use is my nippers. And so if you have any questions or concerns, please let me know. Okay, so I'm going to start by doing small nips. I'm just following the shape of the nail. Okay. Now the next thing that I'm going to do is use the file to file down any sharp edges, okay? If you have any concerns, please let me know. just kind of checking to see if there's any other sharp edges here. Just for some final touches. Beautiful. Okay, and then I'm going to use my black files again just to kind of clean up any debris after the filing and the clipping. Okay, and then I'm going to clean the toes again and just apply another rubbing alcohol swab. Again, just checking to make sure all my edges are nice and smooth. And then the next thing that I'm going to do is apply a moisturizer just to help with that dryness that was noted to the plantar aspect of your feet. And so a little bit of health teaching for you, Josh, is that we never put cream in between the toes, as that builds up moisture, and that's where bacteria and fungus like to grow. A little bit more to the heels. Okay, Josh, that is it for now. How do you feel? Any concerns, questions, anything like that?
Feels great. Thanks so much.
Perfect. Thank you.